Blood clots, while a natural part of healing, can sometimes pose serious health risks. So how do we effectively get rid of them? Blood clots are semi-solid masses of blood that form when blood changes from a liquid to a gel-like or semi-solid state. Blood clotting is a necessary process that can prevent excessive bleeding when a blood vessel is injured. However, clots can also form inappropriately and pose significant health risks. There are two main types of blood clots. Thrombosis. This refers to the formation of a blood clot, thrombus, within a blood vessel, which can obstruct the flow of blood. Thrombosis can occur in veins, venous thrombosis, or arteries, arterial thrombosis. Common forms of venous thrombosis include deep vein thrombosis, DVT, which usually occurs in the legs, and pulmonary embolism, PE, which is when a DVT breaks loose and travels to the lungs. Arterial thrombosis can lead to conditions like heart attacks or strokes. Embolism. This is when a blood clot, or a piece of a blood clot, breaks free from its original location and travels through the bloodstream, potentially becoming lodged in a vessel and blocking blood flow. The most common example is a pulmonary embolism. When a clot forms inappropriately, it can lead to significant complications. For instance, if a clot obstructs blood flow to the heart, it can cause a heart attack. If it blocks blood flow to the brain, it can result in a stroke. Luckily, there are several measures that can help prevent blood clots. While not all clots can be avoided, especially those that result from genetic factors or unforeseen medical conditions, taking certain precautions and consuming certain vitamins, supplements, and food sources can significantly reduce the risk. Number 1. Vitamin E. Vitamin E isn't a single compound. Instead, it refers to a group of fat-soluble compounds with antioxidant properties. The most commonly known form is alpha-tocopherol. Vitamin E has shown some ability to act as an anticoagulant. An anticoagulant is a substance that inhibits blood clotting. The potential mechanism behind this is the vitamin's ability to reduce platelet aggregation and adhesion. In simpler terms, it might make platelets, a type of blood cell involved in clotting, less sticky. The anticoagulant effects of vitamin E generally become more pronounced at higher doses. However, what constitutes a high dose can vary from person to person. Supplements can contain significantly more vitamin E than the recommended daily intake, leading to excessive consumption if not monitored. Nuts and seeds such as almonds, sunflower seeds, and hazelnuts are natural sources of vitamin E, along with green leafy vegetables and avocado. Number 2. Phytonutrients. Garlic, ginger, and turmeric contain phytonutrients. Phytonutrients, or phytochemicals, are natural compounds found in plants that often contribute to the plant's color, flavor, and disease resistance. They also have various health benefits when consumed by humans. Garlic contains allicin. This is the main biologically active component in freshly crushed garlic. It has antimicrobial and anti-inflammatory properties. Once garlic is crushed or chopped, allicin is produced from the precursor compound alliin via the enzyme alliinase. Beyond allicin, garlic contains other sulfur compounds like diallyl disulfide and S-allyl cysteine, which have been studied for their potential health benefits, including anti-cancer properties. Ginger contains gingerols. These are the main active components in ginger and are responsible for its distinct flavor. They have anti-inflammatory, analgesic, pain-relieving, and anti-cancer properties. When ginger is dried or cooked, the gingerols form compounds known as shoguls, and they also have health-promoting properties. Turmeric contains curcumin. This is the primary active compound in turmeric and gives it its yellow color. Curcumin has been extensively studied for its anti-inflammatory, antioxidant, and anti-cancer properties. However, it has low bioavailability in the body, meaning it's not easily absorbed. Consuming it with black pepper, which contains piperine, enhances its absorption. Besides curcumin, turmeric contains other related compounds like dimethoxycurcumin and bisdimethoxycurcumin, which also have beneficial properties. Number 3. Nattokinase. Nattokinase is an enzyme derived from natto, a traditional Japanese fermented soybean food. The primary reason nattokinase has been investigated in the context of blood clots is its ability to break down fibrin. When blood clots form, fibrin acts like a net, holding red blood cells and platelets together. By targeting and dissolving fibrin, nattokinase aids in preventing or breaking down unwanted blood clots. Due to its anticoagulant effects, nattokinase is available in supplement form and is sometimes used by individuals looking for natural ways to support circulatory health or to reduce the risk of clotting. Number 4. Lumbrokinase. Lumbrokinase is a group of proteolytic enzymes derived from certain earthworm species, notably from Lumbricus rubellus. Over the past few decades, there has been growing interest in lumbrokinase for its potential therapeutic benefits, particularly in the context of cardiovascular health. Lumbrokinase is believed to exert its effects by directly breaking down fibrin, a protein that contributes to clot formation. Additionally, it has indirect effects on the fibrinolytic system by influencing plasminogen activation. Plasminogen, once activated to plasmin, is the primary enzyme responsible for breaking down fibrin clots. Number 5. Omega-3 fatty acids. Omega-3 fatty acids, especially EPA and DHA, have been shown to reduce platelet aggregation. Platelets are blood cells that play a significant role in clot formation. By reducing their tendency to clump together, omega-3s can modulate the coagulation process. Additionally, they can influence the balance of eicosanoids, which are signaling molecules derived from fatty acids. Some eicosanoids promote inflammation and vasoconstriction, while others are anti-inflammatory and vasodilatory. Omega-3 fatty acids tend to shift the balance toward the production of less inflammatory and less thrombotic eicosanoids. A great source of omega-3 is, of course, fatty fish, supplements, and cod liver oil. Number 6. Potassium and magnesium. Both potassium and magnesium play crucial roles in cardiovascular health, and they have been studied for their potential influence on various factors associated with blood clotting. Potassium. High dietary intake of potassium is associated with lower blood pressure. Elevated blood pressure is a significant risk factor for atherosclerosis, hardening and narrowing of the arteries, which can contribute to the formation of blood clots. Potassium can influence the tone of vascular smooth muscle cells. Proper potassium balance helps regulate vasodilation and vasoconstriction, contributing to healthy blood flow. The balance between sodium and potassium in the diet is vital. A diet high in sodium and low in potassium is associated with various cardiovascular risks. Adequate potassium intake can help counteract some of the negative effects of high sodium consumption. While potassium is essential for cardiovascular health, its direct role in preventing clot formation is less clear. Instead, its benefits might arise more from its effects on overall heart health, vascular function, and blood pressure regulation. Magnesium. Magnesium has been shown to reduce platelet aggregation. Platelets play a central role in clot formation, and their excessive aggregation can contribute to thrombotic events. By reducing this aggregation, magnesium may decrease the risk of clot formation. Magnesium plays a role in regulating the tone of vascular smooth muscle cells. It can act as a natural calcium channel blocker, promoting vasodilation, which helps maintain healthy blood flow and might reduce the risk of clot formation in narrowed arteries. Magnesium is essential for maintaining the electrical stability of cells, particularly heart muscle cells. It can help prevent certain types of cardiac arrhythmias. Some arrhythmias, like atrial fibrillation, can increase the risk of clot formation in the heart. Both minerals are essential for overall cardiovascular health. While they might not dissolve blood clots directly, ensuring adequate intake can support various cardiovascular functions that, in turn, can reduce the risk of clot formation and other cardiovascular events. And last, number 7, vitamin C. Vitamin C, also known as ascorbic acid, is an essential vitamin with various health benefits. However, its direct role in dissolving blood clots is not straightforward. It is a powerful antioxidant that can help reduce inflammation and damage to blood vessel walls. Chronic inflammation is a known risk factor for the development of blood clots. Vitamin C is essential for the synthesis of collagen, a primary component of blood vessel walls. Healthy blood vessels are less prone to conditions that might promote clotting. Some studies suggest that vitamin C can reduce platelet aggregation or stickiness, which is a factor in clot formation. However, this doesn't directly mean it dissolves existing clots. While not directly affecting clot dissolution, vitamin C may have a role in preventing factors that lead to clot formation. For instance, by lowering blood pressure or improving endothelial function, the inner lining of blood vessels. It is important to note that if you are taking blood-thinning medication, it is crucial to inform a healthcare professional before introducing any new supplements or making changes to your diet. Besides supplements and vitamins, there are other methods to dissolve and, more important, to prevent blood clots. Taking supplements will not help if you don't make certain changes in your life. It is important to avoid smoking. Smoking damages blood vessels, promotes clot formation, and is a risk factor for atherosclerosis. You need to stay hydrated. Dehydration can increase the risk of clotting, so drink plenty of water, especially when traveling. Avoid hormone replacement therapy, HRT, and certain birth control pills. Both can increase the risk of clotting in some people. If you're at high risk for blood clots, discuss alternative medications or therapies with your doctor. Make sure you have a healthy diet. A balanced diet, rich in omega-3 fatty acids and low in trans fats and saturated fats, can support vascular health. Also, if you are on certain anticoagulants like warfarin, you need to monitor your intake of vitamin K-rich foods. Avoid certain foods such as processed foods and vegetable oil. It is important that you keep moving and exercise regularly. Regular physical activity promotes good circulation, which can help prevent blood clots. Not only that, but having a healthy diet and exercising can help with weight management. Being overweight can increase the risk of blood clots, especially in the legs. Maintaining a healthy weight can help reduce this risk. It's important to distinguish between the natural and necessary processes our bodies undergo, and those which can be harmful. Blood clotting in response to an injury is a normal and vital process. However, when blood clots form inside our blood vessels without a clear reason, or they don't dissolve as they should, it becomes abnormal and potentially dangerous. While supplements may offer support, it's equally crucial to consider lifestyle adjustments for a holistic approach to your health. If you have known risk factors or a family history of clotting disorders, regular medical checkups can help monitor and manage your risk, especially if you have diabetes, high cholesterol, LDL, hypertension, or facing chronic stress. If you found this video helpful, please give it a thumbs up and don't forget to hit that subscribe button so you don't miss out on any of our informative and animated videos. And if you want to know more about improving your vascular function, make sure to watch this video. Thank you for watching, and we can't wait to share more with you in the future.